Lab number 1B, application of anti-embolic stockings. First, I would verify orders in the policy. Is this an appropriate intervention for this patient? We want to double check patient's information versus the order. First, I would gather necessary supplies, which at this point would just be the stockings and cornstarch, possibly for lubrication. I would do hand hygiene before entering the room. I would introduce myself. Hello, I'm Monique. I will be your nurse today. I would provide privacy as well while I'm doing this. I'm closing the curtains. I would then hand hygiene and apply gloves. I would explain the use of these TED stockings. So the definition is thromboembolism deterrent stockings. They are designed to support the venous and lymphatic drainage system. So essentially it will help stop blood clots from forming. And they are worn while recovering from illness or when bedbound for long periods of time. This changes compression as it moves up the legs, starting at the ankle. So, can I please get your name and date of birth and CR-based, please?
Alexa, August 1792.
Okay, perfect. Do you have any questions or concerns about this procedure?
No.
Okay, do I have your consent to apply these stockings to your feet?
Yes.
Okay, so we want to make sure the patient is in a supine position and they're comfortable. If they have been walking or sitting, they should elevate their legs for 15 to 20 minutes prior to the procedure. So at this point, I would put the rail down. I would expose the patient's leg. And I would want to assess for scratches or cuts of any sort or any sort of skin breakdown. We want to make sure the skin's intact, otherwise we cannot use these stockings. We want to make sure the legs are warm, and we want to make sure if the patient has any risk factors for venous thrombosis or things like that. So what we will do is we will pull the stocking down halfway, and we'll just simply put it on the patient's foot carefully. And then we are able to roll it up. So at this time, we want to make sure there's no wrinkles, folds, and that the placement is perfect on the foot. If it's left uncorrected, it will cause a lot of discomfort, pressure, and tissue damage. So after this, and it's comfortable, while the wrinkles are out, we would put the rail up. I would move to the other side and apply the other one. At this point, we would make sure after this, the patient is covered, is warm and comfortable, and their foot is elevated, ideally. So at this point, I'd say, is there anything else I can do for you? Do you know where the call bell is if you need help?
Yes. Okay,
I would dispose of my gloves and any necessary linens. I would perform hand hygiene. And then I would leave and document procedure, observations, assessments, and treatments in accordance to the documentation guidelines.